today is elbow flexion, and for this MMT there are two tests, one for the biceps brachii and another for the brachialis and brachioradialis. So I'll start with the biceps. So you're going to want your patient sitting, you're going to want their shoulder in 0 degrees of abduction, their elbow in 0 degrees of extension, and you're going to want their arm in full supination. So the motion I want you to do is just bring your arm up like this, okay. And I'm going to stabilize over the anterior superior aspect of the humerus, and I'm going to palpate the biceps, the middle third of the anterior aspect of the arm. So go ahead and do that motion. Good. So now I'll apply resistance, so you're going to want them flexed to about 90 degrees to 100 degrees. And I want you to hold this position, and I'm going to push proximal to the wrist. Okay, ready? Okay, good. So for the brachialis and the brachioradialis, they're also going to be sitting. Their shoulder is going to be in 0 degrees abduction, 0 degrees elbow extension, and this time they're going to have their arm in full pronation. So again, you're just going to bring your arm up like this. And I'm also going to stabilize over the anterior superior aspect of the humerus, and then this time I'm going to palpate the brachialis, medial to the distal attachment of the biceps and on the anterior lateral aspect of the arm, so basically either side of the biceps tendon. So go ahead. Good. So now I'm going to apply resistance, and again you want them at 90 degrees to 100 degrees flexion. And I'm going to push proximal to the wrist, so don't let me push you down. Okay, good. So if they're unable to do this motion in gravity resisted, we will put them in gravity eliminated. So you want to table with a towel, and they're going to stay seated, and you're going to want their arm at 90 degrees of abduction. You're going to want their elbow at 0 degrees extension, and for the biceps you're still going to want them in full supination. So again, you're just going to bring your arm to like that. Okay. And so I'm still going to stabilize in the same place and palpate the biceps in the same place. So go ahead. And then for the brachialis and brachioradialis, it's the same setup, except for, again, they're going to be in full pronation. So again, I'm still stabilizing over the anterior superior aspect of the humerus, and I'm still palpating the brachialis in the same spot. Okay? And some clinical errors are if you don't stabilize correctly, they could start to lean or rotate their trunk or flex their shoulder, and you want to make sure that they're in the proper supination or pronation for the muscle you are trying to test.